Welcome to the e-learning lesson for healthcare. Let us learn more about needle stick injury today. Let us take a look at the key learning objectives. After completing this module, you will be able to explain what needle stick injury is, explain when and how does a needle stick injury occur, prevent needle stick injury to self and patients. What is needle stick injury? Needle stick injury is the accidental puncture of the skin by a needle during a medical intervention. This can also happen to other occupations, example, refuse collector, cleaners and tattoo artists. This may also affect caregivers or children picking up used needles. These injuries can occur any time when people use, disassemble or dispose of needles. Needle stick injury needs attention because of the risk of transmitting blood-borne diseases like hepatitis B virus, HPV, hepatitis C virus, HCV, human immunodeficiency virus, HIV, the virus that causes AIDS. Many other viruses can also be transmitted which can cause infection. According to a study carried out in a reputed hospital of Delhi, nurses were at highest risk of needle stick injury, closely followed by lab technicians. This is an alarming figure for healthcare workers. Healthcare workers can be affected by needle stick injuries in physicians' offices or clinics, ambulance, nursing homes, nursing facilities and colleges, home healthcare setups, hospitals. Let us take a look at the instances when needle stick injury could occur. Click on each hotspot to know more. Recapping. Recapping used needles pose the highest threat for needle stick injury. Surgery. During surgeries, especially during wound closure. Biopsy and injection techniques. Both patient and healthcare workers can be affected by sharp objects. Bed linen. When an uncapped needle has ended up in surgery clothing, bed sheets, etc. While disposal. When taking an unsheathed used needle to the waste container. After disposal. During the cleaning up and transporting of waste material. A&E department, in accident and emergency departments. Nurse Deepika has joined AP Hospital. Before she undergoes a formal training, Dr. Ajay has given her a book to read about needle stick injury. Help Nurse Deepika find the activities that may lead to needle stick injury. Drag and drop the activities that may lead to needle stick injury. Recapping needle. Recapping is the most common cause of needle stick injury. It is extremely dangerous to hold needle in one hand and try to cover it with a cap in another hand. Only one hand recapping method should be used if recapping is required. Use of sharp objects. Even a slight carelessness while handling sharp objects like syringes, needle, scalpel can cause injury. Improper disposal. More than 30% needle stick injuries occur when workers are trying to dispose of needles. Injury can occur if needle is uncapped or even when the disposal container is overfilled. It is important to dispose of needles without breaking them into the appropriate biomedical waste bins. Use of yellow one caps can reduce needle stick injuries. Let us see how to prevent needle stick injuries. Prepare and position young children securely before giving an injection so they do not grab needles or kick unexpectedly. Always tell patients when you are about to give them an injection. Do not recap, bend or break needles before disposal. Do not manually remove the needle from the syringe. After injections, discard syringes and needles at the point of use. Needle disposal boxes should be closed, sealed and labeled when they are 3/4 full. Burning is one way to destroy needle disposal boxes. Well-functioning incinerators that burn above 800 degrees Celsius ensure the most complete destruction of syringes and needles. To prevent infection further, address needle stick injuries immediately by washing and covering the wound, removing contaminated clothes, and checking blood sample for potential infection. For further information on this topic, please refer to the following links.